You are walking down the street. Maybe you're headed to the grocery store, or perhaps you are just trying to take a gentle stroll around the block to get some fresh air. Everything feels fine for the first minute. The sun is shining, your breathing is good, and you feel capable. Then it happens. A tightness in your calf. It starts as a whisper, just a little nagging sensation that you try to ignore. You keep walking, hoping it will just work itself out. But within 50 steps, that whisper turns into a scream. It feels like a vice grip tightening around your muscle, squeezing the life out of it. It burns. It aches with a deep, throbbing intensity. You have to stop. You have no choice. You stop walking, you wait a minute or two, and the pain vanishes like magic. So you think, it's just a cramp. I'm just getting older. I probably need to drink more water. I need you to stop what you are doing and listen to me very carefully right now. That was not a cramp, and it is definitely not just getting old. That pain is a siren. It is a distress signal from your body that you're ignoring at your own peril. A groundbreaking 2024 study involving over 5,000 adults revealed that this specific type of leg pain is the #1 predictor of future cardiovascular events. Yet less than half of the patients ever mention it to their doctor until it is too late. Most people brush this off for years. They think they just need more bananas for potassium or magnesium supplements. Big mistake. That pain isn't a muscle problem, it is a plumbing problem. Your arteries are suffocating. If you are feeling this in your legs, it means your circulation is compromised. And here's the scary part. Artery disease is systemic. It rarely happens in just one place. If your leg arteries are clogged with plaque, there is a statistically massive chance that the arteries feeding your heart and your brain are looking exactly the same. The leg pain is just the first warning light on the dashboard because your legs are under the most physical stress. If you put a piece of black tape over that warning light and keep driving, the next symptom won't be a calf cramp. It could be a massive heart attack or a debilitating stroke. We're going to fix your walk today. We're going to talk about how to open those lines back up using a method that seems completely backwards, but is backed by hard science. But if you click away now, you're going to miss the single most important warning sign that actually appears on your skin before the pain ever starts. Do not ignore this. Let's talk about what your life looks like right now. I bet I can describe your daily walk perfectly. You leave your house with the best intentions. You make it about 2 blocks. The ache starts in the calf, or maybe the thigh or buttock. You don't want to look frail. You don't want to stop in the middle of the sidewalk and rub your leg like you're injured, especially if neighbors are watching. So you do the window shopper. You stop in front of a store, you pretend to look at the display, you stare at a mannequin or a parked car, or you pretend to check your phone, waiting for the burning to subside. This is actually a classic medical sign. Doctors even call it the window shopper sign. It happens because of a simple supply and demand problem. Think of your leg muscles like the engine of a car. When you're sitting in your recliner watching TV, your muscles are idling. They barely need any fuel. The blood flow is low, but it is enough to keep the tissue happy. But the moment you start walking, your calf muscles are like an engine revving up to 60 miles per hour. They demand 5, maybe 10 times more oxygen and nutrients instantly. Your heart pumps harder to send that blood down the highway of your leg, but there is a roadblock. The highway has turned into a dirt road because of plaque buildup. The blood can't get through fast enough. Your muscles start starving. They panic. That burning sensation is your muscle tissue screaming for oxygen. It is literally suffocating inside your skin. When you stop to look in that shop window, the engine returns to idle. The demand drops. The trickle of blood that can squeeze past the blockage finally catches up and the pain stops. But here's the trap. Resting fixes the pain in the moment, but it does not fix the road. The road is getting narrower every single month, and eventually, if you don't intervene, you won't even make it to the shop window. You'll be stuck in your driveway. We have to widen that road, and we have to do it before the tissue dies completely. Here's the good news. The human body is smarter than we give it credit for. You have a backup system built into your legs right now. It is sitting there, dormant, waiting for you to turn it on. You can actually grow new blood vessels. I am not talking about surgery. I'm not talking about stents or angioplasty. I am talking about your body building its own detour around the blockage. It's called a natural bypass, or in medical terms, collateral circulation. Think about a river that gets dammed up by a pile of rocks. If the pressure is right, the water will carve out new little streams around the rocks to keep flowing downstream. Your blood can do the same thing. It can expand tiny microscopic vessels that you don't even use right now, vessels that are currently shut down, and turn them into robust pathways that bypass the clog entirely. It is a physiological miracle. But, and this is a huge but, most people never trigger this growth. In fact, most people do the exact opposite. They make one specific mistake every time they walk that shuts this process down completely. I'm going to teach you exactly how to flip that switch and force your body to build those new roads. But there's a catch. If you try this walking trick and your problem is actually your spine, you aren't going to grow anything. You're just going to torture yourself for no reason. We need to rule that out in the next 30 seconds because treating the wrong problem is the fastest way to lose your mobility forever. So let's do a quick test. You can do this mentally right now. I want you to close your eyes for a second and visualize your last trip to the supermarket. You're pushing that heavy shopping cart, you're leaning forward over the handle, putting your weight on it. When you're in that position, hunched over the cart, does your leg pain get better? Can you walk further around the store when you are leaning on the cart than you can when you are walking upright to your car? Quick question, does leaning on a shopping cart make the pain stop? Tell me in the comments yes or no. This helps us figure out who is dealing with what, and it helps me tailor future videos to your needs. If you answered yes, if leaning forward relieves your pain, you likely do not have the artery problem we are talking about today. You likely have something called spinal stenosis. That is a narrowing of the spine that pinches your nerves. When you lean forward, you physically open up the spaces in your spine and give the nerves room to breathe. That is a nerve issue, not a blood issue. The treatment for that is completely different. However, if leaning makes zero difference and the only way to stop the pain is to stand dead still like a statue until the burning fades, that is your arteries. That is the claudication we are fixing. This distinction saves years of wrong treatments. You don't want to be doing back stretches for a clogged artery, and you don't want to be taking blood thinners for a pinched nerve. Safety note here, if you have back pain and leg pain, or if you are unsure, go see a vascular specialist. Don't guess with your mobility. But if you are the person who has to stop and stand still, keep listening because we are about to look for the invisible signs that prove your circulation is in trouble. I want you to take your socks off right now. Pause the video if you have to. We are going to look for the warning signs that show up when the blood is struggling to get down to the extremities. First, I want you to lie down on your bed or the couch. Lift your legs up in the air. You can prop them on a stack of pillows or just hold them up. Keep them there for about 60 seconds. Watch the color of your soles and your toes. Do they go pale? Do they look white like a sheet of paper or maybe a waxy yellow? That is called pallor. Because your arteries are narrowed, the blood pressure in your legs is weak. It isn't strong enough to fight gravity. So when you lift your legs, the blood drains out and the fresh blood can't pump up to replace it. Your feet are literally emptying out. Now, sit up and dangle your legs over the edge of the bed. Let them hang down. Watch the color again. Does the blood rush back in? Does it turn your feet bright red, almost like a lobster, or maybe a deep, angry purple? That is called dependent rubor. It happens because your starved blood vessels have dilated as wide as they possibly can in a desperate attempt to catch some oxygen. When gravity finally helps the blood rush down, those wide open vessels fill up too fast, and your feet turn that intense red color. That sunset red foot is a classic sign of advanced arterial disease. Now, look at your shins. Is there hair there? Think back to when you were 30 or 40. Did you have hairy legs? If you used to have hair and now the skin is completely bald, smooth and shiny, that is not just aging. That is starvation. Your body is incredibly efficient. When it realizes there is a shortage of blood, it starts cutting off non-essential services. Hair growth requires energy and nutrients. Your body decides we need to keep the skin alive, we don't have enough blood to waste on growing hair. So the follicles die. No blood, no hair. Also, look at the skin itself. Is it thin? Is it brittle? Does it look like tight plastic stretched over the bone? That is atrophy of the skin due to poor nutrient supply. Try this tiny test. Press your thumb firmly into the tip of your big toe for 3 seconds. Squeeze the blood out until the skin turns white. Then let go. Count how long it takes for the pink color to return. 1, 2. If it takes longer than 2 seconds for that pink color to flood back in, we have a flow problem. In a healthy person, it is almost instant. In someone with clogged arteries, it's a slow, sluggish return. These are the visual alarms your body is ringing. Now that we know what we're dealing with, let's start fixing it. We need to turn your arteries from stiff, rusty pipes into flexible, open hoses. We need to dilate them. The magic molecule for this is called nitric oxide. This was actually the subject of a Nobel Prize in medicine. It is a gas your body produces that signals the smooth muscle in your vessel walls to relax. When the vessel relaxes, the road gets wider and more blood flows with less effort. It decreases the resistance in the entire system. You can boost this immediately from your kitchen. You need nitrates. The kings of nitrates are beets and leafy greens like arugula, spinach, and kale. Research has shown that dietary nitrates can significantly improve exercise performance in people with artery issues. Adding a glass of beet juice or a large spinach salad to your daily routine is like pouring fuel injector cleaner into your system. It primes the pump. But here's the catch. You might be pouring your circulation down the drain every morning without even realizing it. Do you use antiseptic mouthwash, the kind that burns and promises to kill 99% of germs? If you do, you are killing the only bacteria in your body that can fix your arteries. This is a crucial piece of insider knowledge that most doctors forget to mention. Here's how it works. You eat the spinach, your body absorbs the nitrates, but your body cannot use those nitrates yet. They have to be converted into nitrites first, and the only thing that can do that conversion is a specific family of bacteria that lives in the deep crypts of your tongue. They are your friends. They're essential for your heart health. When you swish with that heavy-duty antiseptic mouthwash, you nuke your mouth. You kill the good guys along with the bad guys. A study from the University of Plymouth showed that using antiseptic mouthwash can lower your nitric oxide levels and actually raise your blood pressure within hours. You are literally washing away your body's ability to dilate its own arteries. So stop the scorching mouthwash. Switch to a mild, non-antiseptic rinse, salt water, or just stick to good old-fashioned brushing and flossing. You need those bacteria to help your legs walk. If you're finding this helpful, hit subscribe so I can help you fix your circulation next week too. We talk about this kind of practical stuff all the time, and I don't want you to miss the video we are planning on the best foods for unclogging arteries. Now, we arrive at the most important part of this entire video, the exercise protocol. This is where most people get it wrong because it is completely counterintuitive. Your instinct tells you to avoid pain. If it hurts, you stop, right? That is how we protect ourselves from injury. If you put your hand on a hot stove, you pull it away. But for this specific condition, intermittent claudication, that instinct is leading you astray. Science tells us that to fix this, you have to walk into the fire. You have to create a mild state of oxygen hunger. We need to create a demand that forces the body to adapt. If you never push the engine, the mechanic never shows up to upgrade it. If you always stay within your comfort zone, your body assumes the current blood flow is adequate, and it will never trigger the growth of those collateral vessels. Safety first. Stop immediately if you have chest pain, dizziness, shortness of breath, or heart palpitations. Talk to your clinician before starting this, especially if you have a history of heart issues. We are targeting leg discomfort, not heart stress. If you feel anything in your chest, jaw, or left arm, that is a medical emergency. But if the pain is isolated to your leg muscles, we can work with that. Here is the protocol, often used in cardiac rehab centers around the world. I want you to go for a walk. Walk at a normal pace. Walk until you feel that claudication pain start. Now, I want you to visualize a pain scale of 1 to 10. A 1 is just noticing the pain. A 10 is the worst agony you can imagine. Most people stop at a 1 or a 2. I want you to keep walking. I want you to push through that initial barrier. Walk until the pain is a 3 or a 4. It's annoying. It's definitely there. It is a mild to moderate cramping. You are pushing slightly past the comfort zone. You are telling your body, I need more oxygen than you are giving me. Once you hit that moderate discomfort, stop. Stand still or sit down. Rest until the pain goes all the way back to 0. This is crucial. You must let the pain completely resolve. Then stand up and start again. Repeat this cycle of walk to pain, rest to 0 for 20 or 30 minutes. We are not pushing to agony. We're not trying to be tough guys. We are just nudging the boundary over and over again. Remember that natural bypass I promised earlier? The one where your body grows new blood vessels? This walking protocol is exactly how you trigger it. And this brings us back to the secret I teased at the beginning. The critical mistake most people make is stopping the second they feel the first twinge of pain. They feel a 1 out of 10 and they sit down immediately. When you do that, the signal never gets loud enough. Your muscles never send the chemical distress flare, specifically a protein called VEGF, vascular endothelial growth factor, that says, we need more blood vessels down here. If the demand is low, the body thinks, nah, the current plumbing is fine. But when you walk into that 4 out of 10 discomfort, your muscles are screaming for oxygen. They release those growth factors. These are chemical messengers that travel to the nearby healthy arteries and say, build more roads, we're starving. Over weeks and months of this controlled persistence, tiny little capillaries that were previously useless start to expand. They connect with each other. They collateralize. They literally build a biological bypass around the blockage in your main artery. If you stop too early, you never send the order to the construction crew. The secret is not speed. It is not distance. It is controlled persistence into discomfort. You have to feel the burn to heal the burn. It is a specific medicinal dose of walking. While you're working on building those new vessels, let's make sure we aren't sabotaging the blood flow you currently have. You would be shocked at how many people suffer more than they need to simply because of their shoes and socks. If your arteries are clogged, the blood pressure in your feet is already low. It's weak. It's like a hose with the faucet turned almost all the way off. If you shove that foot into a tight shoe, you are applying external compression that collapses the few surface veins that are still working. You are putting a tourniquet on a starving limb. Check your laces. Most people tie them way too tight right across the bridge of the foot, the top part of the arch. This is exactly where the dorsalis pedis artery runs. It is a major supply line for your foot. If you crank your laces down tight over that artery, you are manually shutting off the blood supply. Try this. Loosen your laces significantly over the top of the foot. Skip an eyelet if you have to. Use a parallel lacing technique instead of the crisscross method to reduce pressure points. Give the blood room to move. You should be able to slide a finger easily under the laces. And check your socks. I want you to look at your ankles right now. Or better yet, wait until tonight when you take your socks off. Look at the skin. Is there a deep, angry red ring indented into your leg? Does it look like an hourglass where the flesh is squeezed in the middle? That indentation is a disaster for your circulation. It acts exactly like a rubber band, making it harder for blood to get down and even harder for the lymph and venous blood to get back up. That ring means your sock is too tight. It is strangling your microcirculation. Go buy diabetic socks or loose-top socks. They are designed specifically for this. They stay up without squeezing. It is a $10 fix that can reduce your pain immediately and improve the health of your skin. You want to remove every single barrier to flow. Another factor that people over 55 often ignore is hydration. As we age, our thirst mechanism gets broken. We don't feel thirsty even when we are dehydrated. When you are dehydrated, your blood volume drops. Your blood gets thicker, more viscous. Imagine trying to pump maple syrup through a straw versus pumping water. When your blood is thick, it is much harder for it to push through those narrowed arteries in your legs. You need to drink water. You don't need to drown yourself, but you need to keep your urine pale yellow. If it looks like apple juice, you are dehydrated and you are making your leg pain worse. Start your day with a full glass of water before you even have your coffee. This thins the blood naturally and helps with circulation. And one more environmental tip. Keep your legs warm. Cold is a vasoconstrictor. It makes blood vessels clamp down and tighten up. If you have poor circulation, stepping out into the cold winter air can cause an immediate spasm in your arteries, making the pain start much sooner. Wear thermal long underwear. Wear wool socks. Don't let your legs get chilled. You want to keep those vessels as relaxed and open as possible. If you sleep in a cold room, wear loose socks to bed. Keeping the feet warm can actually help signal the arteries to stay dilated. I want to be real with you as we wrap this up. This is not an overnight fix. You cannot drink one glass of beet juice and walk around the block once and expect to run a marathon tomorrow. Physiology doesn't work like that. Growing new blood vessels takes time. It takes months of consistent effort. It is a slow, gradual process of adaptation. Some days will be hard. Some days you will feel like you are going backward and you can't walk as far as you did yesterday. That is okay. That is normal. Progress is never a straight line. Start slow. If you can only do 5 minutes of the walking intervals before you are exhausted, do 5 minutes. The key is that you do it. Consistency is more important than intensity. The pain you feel is communication, not just punishment. It is your body telling you what it needs. Listen to it, respect it, but do not fear it. You have the power to change your physiology. You are not a victim of your age or your arteries. You can take control. You can walk further. You can reclaim that block, then the next block, then the park with your grandkids. Just take it one step at a time and remember to push into that level 4 discomfort just a little bit every day. There is so much more to learn about your leg health. For example, did you know that the position you sleep in can affect your leg pain? Or that certain common medications might be making your cramps worse? We cover all of that in our deep dive video about sudden leg pain while walking that stops when you rest. It is the perfect next step after this one. Tap the card on the screen right now to watch it. It will give you the complete picture of how to protect your mobility for the rest of your life. I'll see you there. Let's review the plan one last time so you can start today. First, check your symptoms. Is it the window shopper pain? If so, rule out the spine by thinking about the shopping cart. If leaning doesn't help, It's the arteries. Second, check your feet. Look for the pale color when elevated and the red flush when sitting. Check for hair loss. Third, fix your chemistry. Eat your beets and greens and throw away the antiseptic mouthwash to save your nitric oxide bacteria. Fourth, and most importantly, start the walking protocol. Walk to a mild pain, level 4, stop and rest to 0, and repeat. Do not stop at the first sign of discomfort. Send the signal to build the bypass. Fifth, optimize your gear. Loosen those laces and get non-binding socks. And finally, stay hydrated and keep your legs warm. This is your roadmap. It is simple, it is free, and it is effective. But it only works if you do the work. Don't let the fear of pain keep you in the chair. The chair is the enemy. The walk is the cure. I want to leave you with a thought about lost profit. Think about the things you have stopped doing because of this pain. Maybe you stopped going to the mall. Maybe you stopped walking the dog. Maybe you stopped traveling because you are afraid of the long walks in the airport. That is the profit you have lost. That is the joy that has been stolen from you. But it is not gone forever. You can earn it back. Every time you do that walking interval, every time you push through that resistance, you are buying back a piece of your freedom. You are investing in a future where you can say yes to the walk, yes to the trip, and yes to life. Do not underestimate the power of your own body to heal. The medical term collateral circulation sounds technical, but it is really just a fancy word for hope. It is the biological proof that you are designed to survive and adapt. Your body wants to walk. It is begging you to give it the signal to grow those new vessels. So put on your loose shoes, drink your water, and go give it that signal. If you found this video valuable, please share it with a friend or a family member who might be struggling with walking. You might just save their life, or at least help them get their freedom back. And don't forget to tell me in the comments how your walking program is going. I read them and I am rooting for you. See you in the next video. Keep moving.